Right. First of all, just in case there's any self-doubt in your mind, I know the criminal system, justice system in Wisconsin. When we arrest an adult, we do not allow the children in the jail cell with them. And I'm not aware of any state that does. And I have heard no complaints in Wisconsin, even from the most left-wing of Democrats, saying that we arrest somebody for breaking the law and putting them in jail, that we're tearing apart families. So at least that's the way they feel about it in Wisconsin. I wanted to comment a little bit on the Medicaid program. The 7 states in 2015 with the highest rates of opioid-related overdoses, West Virginia, New Hampshire, Kentucky, Ohio, Rhode Island, Pennsylvania, and Massachusetts, all expanded Medicaid programs under Obamacare. And obviously you get cause and effect all mixed up here is what's coming first, but way disproportionately people on Medicaid are far more likely to die of a opioid overdose than people who are not on the program. Could you comment on that? And is there anything we can do? Do you feel the Medicaid expansion made the opiate situation worse? And is there anything we can do, again, remembering that, kind of it's hard to tell in these things what the cause and, what's the cause, what's the effect. But can we do anything on the Medicaid program to kind of cut off the supply here?
So the ready availability of cheap, accessible, legal opioids, especially generic opioids, was fundamental to this problem. The majority of people who get addicted on opioids start from a legal prescription for opioids. Making the financing and accessibility of those readier obviously contributes to it. How much I can't say, but it's quite clear that would be connected. So what we've got to do is get at the issues at the state level and federal level of how often people are prescribed, why they're prescribed, how many they're prescribed. With Medicaid, that's why we're asking for prescription drug monitoring programs as well as interoperable across state lines, so you can't shop from West Virginia into Ohio, for instance, and go doc shopping. We're enforcing against pill mills from our Inspector General's office and the Department of Justice. So it's a very serious issue. You raised the right questions.
Good for me. One final question. Overall, prescription drug use in this country is way higher than any other industrialized nation, and obviously very expensive. And I wonder if you could comment on that in general, your opinion on the amount of prescription drugs prescribed in this country.
Too expensive, but I would say that a lot of the major innovation we've had in healthcare delivery, if you ask doctors, is from the availability of new therapies, not necessarily new procedures. And so we actually need more reform on that other side, but we're paying too much, absolutely, for our drugs.
Thank you.